All right, so we're here to talk about the MIND project, and the MIND project stands for Mental Health Intervention, Networking, and Diversion. And I'm Dr. Ginger Gummelt. I'm the chair of Sociology, Social Work, Criminal Justice, and Anthropology. We didn't fix that, did we? What would be my right? I don't know. Raise your hand. Malick. This is Stephan Malick. He's an instructor of communication with the College of Fine Arts and Communication. On this side is Karen Roebuck, an instructor of criminal justice with the College of Arts and Sciences. One more down is Dr. Mamta Singh. She's an associate professor of teacher education with the College of Education and Human Development. And on the end is Wright, who is our program director of social work and our field director of social work, and our instructor. So obviously we didn't quite update those. Whoops. So moving on, a little bit about our mental health interventions, networking, and diversion. So obviously this is a cross-discipline, interprofessional, and cross colleges venture that we have taken on. It's both education, it's outreach, and there is a research piece to it. It is funded through the Center for Resiliency with Lamar University. And that piece, the Center for Resiliency, focuses on response and resiliency related to particularly disasters. And I'll talk a little bit about that in just a minute. So,
okay. For every mentally ill person in a state psychiatric hospital, 10 are sent to state prisons or jails, from takeapart.org.
So this project, our MIND project, it focuses on some interventions related to the criminalization of mental health. So it's aimed at diverting mental health referrals away from the criminal justice system and with a real focus on the post-disaster. As I said, we are funded through the Center for Resiliency, and we give a huge shout out and thank you to them. It's their setup and their fancy stuff that we don't know how to use. But we know that post-disaster, and our area has been prone to many major disasters within the last 10 years, massive floodings, also, I can't even go into how many disasters year after year, the hurricanes and the floods that have hit our area. And we know that that only exacerbates mental health issues, which then in turn exacerbates connection to the criminal justice system. So that's kind of the tie all right there. So we have three main project goals in this project. Number one is to provide an outcome analysis of this pilot program that addressed mental health diversion services, especially post-disaster. Goal number two is to establish experiential learning internships that improve the identification, treatment, and referral services for undiagnosed mental health issues. And goal number three is to develop a model program for mental health intervention and diversion services focused on that post-disaster trauma for replication in other courts, counties, and centers. So goal one, I'm going to turn over to Roebuck.
Over 80% of the referrals made to the mobile mental health unit have never been referred for mental health services. And over 90 of those referred to the mobile mental health unit have qualified for the mental health services at our local mental health authority. Mental health illness is highly overrepresented in the criminal justice system. There's many diverse groups, various levels of mental health needs seen, ranges of violations, lack of diagnoses and treatment. And this leads to what we call the criminalization of mental illness. Deinstitutionalization refers to the diversion and intercept points where diversion might take place anytime in the criminal justice process. It typically occurs in the first three phases of the criminal justice contact. First would be the law enforcement phase. Second would be pretrial and the prosecution phase. And then third would be the court phase. However, early diversion and intervention can significantly increase the successful treatment of mental health issues.
I'm able to see the person as they are, not as some charge or crime. This is a quote from one of our MIND student interns.
Go to. So this MIND project is a collaborative, the MIND project uses a collaborative approach where students from different disciplines or full disciplines, they come together and form a learning community. And what they do is they know, what they know about the topic and also related to the problems. And also these students, they take advantage of an interdisciplinary perspective because they all come together and work together in the learning community. And from an education perspective, what we do is we focus on mental health literacy, and ask them to, know and understand the definition and also provide information for teacher education department. And additionally, for teacher education, why mental health literacy or this MIND project is important is because, as we all know, teachers are frontline identifiers. Having accurate knowledge to recognize and address issues required by teacher education standards. And the standard is Association for Advancing Quality in Education Preparation Program Standards, which requires our educators to address and implement social emotional learning. So for this MIND project, we had 4 disciplines coming together and forming a learning community. As you can see, we have social work, criminal justice, communication, and education departments. And we have participants from each of these disciplines. So social work, we had so this is a follow-up from last year project as well. So 2 social work students from last year, 2 social work students from this year, same with criminal justice 2 and 3 respectively, and same with communication 2, and education. We had 6 students participating last year, whereas this year we're involving entire class education students for this project. And each students, they are required to work like 100 hours per semester. And the way it works is 15 hours these students work face-to-face, and then 85 hours is online or virtual learning.
So real quickly, just a comparison of timelines. We launched this project last year, and kind of trying to figure out what was the best model. We started out with a pre-test, just to kind of get an idea of where all of our students landed as far as mental health literacy goes. So we did that pre-test. We started them in internships, provided some mental health training, and then did a kind of a midterm assessment to see, where their knowledge landed again. And then through the rest of their internships, I know for social work students, those internships are 400 hours, and this is a 100-hour piece of that. So to see where they and the other disciplines ended up on that post-test really kind of gave us a better idea of where to launch this year's timeline, which you'll see on the next slide. We shorted up a little bit better this year, still offered that pre-test, came up with some clearer goals and objectives and some real specific training modules focused on mental health literacy, as well as an introduction to the criminal justice system and kind of the intersection there. Then we created a course in one of our Blackboard modules where students go in weekly after they process some of this through those internships, and they answer some discussion questions, share some reflections, and we've got a graduate research assistant that is kind of the liaison between the students and us in the project this year. So the students continue to do that. This grant that was made possible through the Center for Resiliency also has offered us the opportunity to offer our students stipends for those internships, which I think is very important to do in our work.
Another quote from one of our MIND student interns. What I've learned is that people want to be heard, and these proceedings give them the chance to be heard.
So again, specifically looking at the social work internships, we have 2 students who were doing their internships already at Spindletop Center, which is our local mental health authority. Also doing some collaborative work with Family Treatment Drug Court, as we know that mental health and substance use issues often go hand in hand. So that's where our students were already placed, and then incorporated the MIND project into those existing internships. And so with kind of putting some of this knowledge and theory into practice, our interns obviously are increasing their mental health literacy, having the opportunity to work with not only in the court system, but with mental health professionals as well as sheriff's deputies who here locally have been trained to assist in those mental health crises. They're doing intake, assessment, outreach, and referral. And then all of our disciplines are working together to provide support to this population with these, oftentimes undiagnosed mental health issues in order to provide those referrals and help advocate for them.
Another quote from one of our mine student interns: "The gravity of the realization that I'm helping people who are in an extremely vulnerable position pushes me to be a better student, social worker, and person."
And very similar to what Ms. Wright indicated with the social work students, criminal justice students also experienced the same thing. They did the internships with Spindletop Center, the local mental health authority, worked in the Jefferson County court systems through a field placement where they looked at programs with stakeholders and partnerships in the local mental health authority and networking, education, and communication.
As you've seen with some of our quotes, testimonials from our student interns, one of the major points that we wanted to come across with our student interns is the idea of an experiential learning environment. We're preparing these students for a variety of roles within their assigned disciplines, and we're trying to also evaluate our pedagogical approach to how we do our classroom education, but also things outside the classroom. Again, the experiential learning environment. And this comes into the numbers of students we had, where they were placed, the type of training they had, research methods, and how we were going to make assessments and analysis of a lot of this. For example, with the communication students, part of their process is essentially, these are students who are in public relations, advertising, journalism, reporting and observing not only their experience through it, but that of the other student interns. They in turn create a portfolio project, much like some of the blogging we've heard in other presentations, where they're able to demonstrate the real world experiences they've had, but also we're using that as a means to provide assessment analysis for the other interns through the use of testimonials and how they transition and evolve from the start of the project through the end of the project. Again, what we're doing with our student interns, as we went through this process, we realized how communication plays a role in a variety of aspects of this. It's not just us communicating with our students, but our students communicating with these experiential places that they're working with, stakeholders out in the community, but also the communication they have within themselves. Part of it is for them to have an understanding of their choices, their opportunities and ownership of their learning, having a voice in it, and then of course, very importantly, creating authentic work from it. And again, they do that through their portfolios. In addition, part of what they're doing in terms of service to client populations or stakeholders is helping to deploy, understand, and create different communication strategies. We found that from the different stakeholder groups, whether it's the courts to law enforcement to the providers, everyone speaks a different language of sorts. And so thought of communication and how that is done needs to be on a very broad level, but also too being able to bring that networking component into the project. So as our interns, but also the stakeholders themselves go through these different processes, they have a working professional relationship and a kind of a base point to work from. And then of course, as we go through all of this, we're providing feedback and reports to these various stakeholders. One more final quote from our Mind student interns. People said, "I'm hurting right now, and no one is seeing me."
But
Yeah.
so where are we now? So we are in year 2 of this project. We began this project in 2022, correct?
Mhm.
And did data collection, learned a lot about the internships, learned a lot about the data we were collecting. We presented our first year findings at the National Social Science Association conference last April. This year, again, we're presenting in April because that seems to be when we kind of get things wrapped up. We do have a journal article that was recently submitted to the Social Work Education. And the findings in that article really focus on the qualitative information we gain from these students about their experiences participating in this project. The things that they developed, such as a greater sense of empathy, a better understanding of how criminal justice and mental health interface with one another. So some really interesting insights there. And then we do have a website that is currently under construction. I would have it more ready, but it's a really tedious process we found.
Bigger than we thought.
Bigger than we thought. So that leads us to what goal 3 is, which really is what I just summarized for you. Goal 3 focused on making sure we had a stakeholder summit in our area of all the key players, the key stakeholders who interface with criminal justice and the mental health issues. And we did that last July. And from that came a lot of discussion about developing a diversion center here in our area. We do not have one. Some of the larger cities around us do. Our Jefferson County area is a pretty large area. We've got about 200, almost 300,000 in Jefferson County. However, we don't have the resources, say, that Houston does, which is about 65 miles to our west. We've looked at collaboration and expansion. We do know that we want to expand out to other counties and that we want to include other disciplines as well. And then from there, we're looking at publications and grants, and we are currently writing a grant right now to continue the funding so that we can expand from there. So this is the last quote, I do believe.
And I should say the quote prior was one that our student intern received from one of the clients within the court proceedings that they were involved with. But you're not alone. You have a community of people who support you. And this is a unknown author quote that we all kind of enjoyed and thought should be included. But one of our student interns added that this quote is the best example of what the overall purpose of the MIND project is. And that, of course, is what we wanted to try to demonstrate and show going through this process with our students in these experiential learning environments.
So lastly, our contact information, should you have any questions or want to reach out to any of us, here is our contact information as well as our disciplines, our respective disciplines there. I do have the wonderful reference slide, which I'll pop up in 1 second, but we'll leave that one up for a second so you can catch. And as you can see, the interdisciplinary nature of this project has made it unique, challenging, and probably the most fun. It has been a lot of fun working cross disciplines, cross professions, and cross colleges at our university, because as most of you know, in the university settings, we don't often cross our little areas. So it has been a lot of fun. With that, what we're obliged to post all of our references, and then we will hold questions, of course, at the end. And I'll stop sharing, I promise.